This is the Queen's Medical Centre in Nottingham, and this is their simulation centre, where medical students and staff come to hone their skills, practising on state-of-the-art mannequins that can replicate a range of clinical conditions. Now researchers at the neighbouring University of Nottingham have taken medical simulation to the next level. Scientists from the university's schools of mechanical engineering, computer science and human development have come together to create the prototype of a simulator that combines three-dimensional computer graphics with technology that allows surgeons to feel as though they're actually touching a human brain as they operate.
The simulator is a device, a method of obtaining a response to a device which you hold by the fingers, and the force in the device feeds back from the computer to allow you to feel an object which is not really there, it's virtually there, and you can feel the response of that object wherever you actually poke it in space.
Dummies can only go so far. You are still limited by the physical presence, and you can't do everything. You can't do major surgery on dummies. It doesn't work that way. You can simulate electrically and phonetically what is happening, but nothing more than that. Virtual reality and specifically force feedback has all the advantages for teaching people to do proper surgery.
Traditionally, surgeons working on such advanced operating techniques have relied on training based on observing practicing surgeons and conducting operations under supervision. Pressure on resources, staff shortages and new EU directives on working hours make this means of on-the-job learning increasingly difficult to accommodate.
Previously, we trained neurosurgeons on the job. There are problems with that. First of all, risk to the patient, risk for infection. MRSA is very high on the cards these days in publicity. There's also restriction of working times. Our trainees have to obey working time directives, and there is less exposure to big and complex operations. Training on the job is good, but you can only go so far. And I would hope that we could come to a form of accreditation of simulator operating, much as you do in civil aviation.
Surgeons were able to test the prototype of the simulator at a conference in continuing medical training held recently at the university's medical school, and were clearly impressed by the feel of the experience. The simulator is particularly effective in that it is able to make cuts in the graphic-generated brain, something that previous machines have been unable to do. This simulation of surgical cutting in real-time computing is particularly difficult to achieve. Cutting creates new surfaces that did not exist before the cut was made. Nottingham's researchers have devised new computational methods that allow the software to respond to the cut in real time.
The difficult part and the unique part of this project is that you can have a surface, you know the properties of the surface, which means you know the properties of the inside, but being able to cut into it, create a new surface, pull them apart and do it all over again in an update time for the computer which is very short and which is approximate the same speed as a human neuron, that makes all the difference. You can use other techniques, but your update will take you 25 seconds or even minutes to do. This update is nearly in real time.
The University of Nottingham's researchers are convinced that this new simulator can be used to train surgeons to a higher level before they graduate to the operating theatre, making complicated surgery significantly safer for patients and greatly reducing the risk of complications. In the long term, the possibilities for this medical simulator could be even more exciting.
If you project maybe 4 or 5 years from now, it may be possible. Indeed, it's quite feasible for a surgeon to operate on a patient totally remotely. So the surgeon will be located somewhere else in the world and can communicate through the internet possibly with some robotic assistance, can actually feel the operation as they are seeing it on the screen.
Creating a new simulator like this may not be brain surgery, but it really is the next best thing.